In this presentation, we will be going over the unit on assumptions. An assumption is a realistic expectation, which is something that we believe to be true. However, no adequate evidence exists to support this belief. In other words, an assumption is an act of faith which does not have empirical evidence to support it. Assumptions can be defined in a multitude of ways. Below are some commonly known examples. Something you consider likely to be true, something that you accept as true without question or proof, something that is believed to be true or probably true, but that is not known to be true, a thing that is accepted as true or as certain to happen without proof, an idea that is formed without evidence. Now, what do you understand about assumptions? The unit on assumptions was a great common ground. It opened a line of communication that was relatable. Most people are guilty of assuming, but is this considered a bad thing? A good thing? Neutral? And why do we assume things? As we move further into this presentation, we will go over some examples of assumptions, examples from class and from outside of class, as well as how we believe assumptions can foster or hinder us in a healthcare setting.
In class, we learn many things about assumptions. The main thing is that assumptions are usually just a guess. The accuracy of them vary depending on the situation. However, one very good example of this is the video "If we could see into other people's hearts." On the outside, all the people look normal, but then we learn that all have their own stories. Everyone has something we don't know about. It's easy to assume that someone has a perfect life on the outside, but sometimes what's going on the inside has a huge impact, so it's important we be not too quick to assume. Assumptions in the outside world. Working in the healthcare field, a couple times I have saw people assume stuff about patients or even assume stuff about the nurses. We often have patients coming in going through alcohol withdrawal or drug withdrawal, and the first assumption everyone makes is that patient is a bad person, when it's not always true. Everyone has battles that they face, and just because we don't always agree with those doesn't mean that the person is bad. Sometimes the support system is all they need to get back up and work on themselves, and as their care team, it's your job to do so.
What does this mean for us as we continue the path to become healthcare professionals? As a nurse, we are to be the patient's advocate. Sometimes we may think that we are working in the patient's best interest and disregard the patient's suggestions. Whether the patient's suggestion or comment was better or not, we are there to make the patient more comfortable. By disregarding the patient, not only can we come off as arrogant, but we can also be making the patient feel unheard. Though assumptions are generally accepted as a bad thing and should never be done, they are necessary for everyone to have. Our assumptions stem from our backstories. It is through the events that have occurred in our lives that allowed us to develop the views we have about the world and what we know. Without those experiences, we wouldn't be able to become better healthcare providers.
So for our symbol, we chose our symbol to identify as a question mark. obviously with the word assumptions through it. It hovers over the globe, kind of taking the meaning that, we're all unique beings, but we all do assume things, whether good or bad. It's something that's globally common, and it's all something that we can work on.